So good afternoon, students. Today we will have a quick revision of what you have been taught in the demonstration of stomach. So revising from the external features. So first of all, as ma'am told you that the stomach has two ends. These are the two ends. Then two borders. The two borders, lesser curvature and greater curvature, and then the two surfaces, anterior surface and posterior surface. The stomach is a bit oblique, so you can also say that the anterior surface is anterior superior and the posterior surface is posterior inferior surface. Okay, and then the two notches. So at this proximal end, you can see that this is the lower end of esophagus and this is the start of stomach. So this is the cardiac end and this is the cardiac notch, and this is cardiac notch, and then this between the vertical and the horizontal part of lesser curvature, this is the incisura angularis or the angular notch. Okay, and then two surfaces, this surface anterior and the posterior surface. Okay, so the external features. Then you can feel the cardiac end. I cannot feel any anatomical sphincter. It is just the continuation of lower end of esophagus into stomach. Okay, so the cardiac end, but at the lower end I can clearly feel the thickened muscle layer. So this is the pyloric end, then the lesser curvature, the greater curvature. Then the relations of the stomach, anterior relations. So in anterior relations, you were confused how the lung and the pleura are related to the stomach. So if you see in this cadaver, you will notice that this is the stomach and it is covered with diaphragm. Okay, rib cage has been removed. So 7th, 8th, 9th and 10th rib along with their posterior cartilages have been removed. They are also from the anterior relations. So this diaphragm was attached to the ribs which has been removed. Okay, so this diaphragm comes in the anterior relation. If you see above the diaphragm, this is the left dome of diaphragm. So this area will be related to the left lung. Okay, the left lung. So inferior surface of left lung. Also this layer of attached to the inner surface of ribs is the parietal pleura, and this is the costodiaphragmatic recess. This semilunar area, my fingers are dipping into this costodiaphragmatic recess. Okay, so the parietal pleura as well as the left lung will be related to the stomach from the anterior aspect. Okay, so these all structures will be forming the anterior relation as well as the superior relation. अब अगर हम fundus को देखें, then the stomach is superior also, and then it is also forming the posterior relation. ठीक है, so this part of diaphragm is posteriorly related. So from above downwards, if we see the posterior relations, so first of all you will see diaphragm. See, I have lifted this stomach. So if I trace from above downwards, this is the posterior aspect of diaphragm. Then in this part, this is the suprarenal gland and the upper part of kidney covered from the anterior aspect by the peritoneum. Then this is body of pancreas. The tail part is intraperitoneum, and then this is the transverse mesocolon. So from above downwards, diaphragm, then left suprarenal gland, then left kidney, and then this pancreas, and then the transverse mesocolon are forming the posterior relations. And posterolaterally, you can also see the spleen. See the spleen, it is related posterolaterally to the stomach. Okay, so these are the anterior posterior relations. If you see here that the anterior surface is related to the inferior or visceral surface of the liver. So this is a specimen of liver. This is the anterior surface, the superior surface, a small posterior surface, and the inferior surface. So this inferior surface is mainly related to the visceral organs around the liver. So this is also known as the visceral surface of liver. So this is the left lobe of liver. If I superimpose this liver onto the body, Then you can see that this part of stomach is related like this. Okay, so this way the liver is forming the anterior relation of the upper part of the stomach. Also, if you see here carefully, this groove just left to the caudate lobe. This is groove where this esophagus is related. So here there is diaphragm, and then through the diaphragm, this is the abdominal part of esophagus. This is the fundus part, body part, and then this is the quadrate lobe of liver, where you can find the pyloric part or pyloric end of the stomach related. Okay, so this is how the stomach is related to the liver along with esophagus. Okay, so this groove is for the this part of esophagus. So after revising the relations and the external features, now we come to the blood vessels which are supplying the stomach. So in this body, see this blood vessel is the celiac trunk. Celiac trunk is the first ventral branch of abdominal aorta in the abdomen. Okay, so this is the first ventral branch of the aorta, abdominal aorta in the abdomen. See, just after arising from the abdominal aorta, it divides into three branches. The one which is running towards the left is the splenic artery. The one which is running towards the right is the common hepatic artery, and the one which is running towards the lesser curvature of the stomach is the left gastric artery. Okay, so most of the branches which are supplying the stomach are coming from the celiac trunk, either directly or indirectly. So the major vessel which is supplying the stomach is this, the left gastric artery. Can you see this left gastric artery taking a turn along the lesser curvature and then giving branches? These branches again divide into anterior and posterior branches and supply the anterior and posterior wall of stomach. It is running along the lesser curvature and it is anastomosing with the right gastric artery. We will search for the right gastric artery later. Till then, this is common hepatic artery. Okay, common hepatic artery has given off this gastroduodenal artery. Okay, so after giving gastroduodenal artery, this artery is continuing as the proper hepatic artery. If you see the relation of gastroduodenal artery, see this thickening is the pyloric end of stomach and this is the first part of duodenum. So this gastroduodenal artery is related posterior to the first part of duodenum. If I lift the stomach, I can see the course of this gastroduodenal artery. See, this is the gastroduodenal artery. It is giving this branch. This is the right gastroepiploic artery. Okay, and then the left gastroepiploic artery is given off by the splenic artery. So splenic artery specifically runs along the superior border of pancreas. This is pancreas, and see this splenic artery. It is running along with the splenic vein. So this vein is the superior splenic vein, and the artery is splenic artery. So this splenic artery, after reaching the hilum of the spleen, this is the spleen. This area is the hilum of the spleen. The hilum of the spleen. Can you see these branches? These branches are short gastric branches. Then a major branch is given off. This branch is the left gastroepiploic artery, and it is running in the folds of greater omentum along the greater curvature, anastomosing with the right gastroepiploic artery. Okay, so the major blood vessels are ultimately derived from the celiac trunk. Okay, so the left gastric, the right gastroepiploic, the left gastroepiploic, the short gastric arteries, and a small part close to the cardiac end is supplied by the left inferior phrenic artery, which is the first lateral branch from the abdominal aorta. Right gastric artery, see this artery. So this is the proper hepatic artery. This artery given off by the proper hepatic, it is running along the lesser curvature. So this is the right gastric artery and it is anastomosing with the left gastric artery along the lesser curvature. So these are the arteries supplying the stomach. We will again revise the lymphatic or drainage of the stomach. So this area where the stomach is related to spleen, close to the hilum, you can see the pancreas behind, then the spleen, and then the stomach. So this area has pancreatico-splenic nodes. Pancreatico-splenic nodes. So this area along the short gastric arteries, along the left gastroepiploic arteries, drains into pancreatico-splenic nodes. Then this part of the greater curvature drains into left gastroepiploic nodes, right gastroepiploic nodes, and close to the pylorus. This is the pyloric canal. Okay, this is the pyloric antrum, and this part is the body. So close to the pyloric, and we have the pyloric nodes. Along the lesser curvature in the lower part, we have the right gastric nodes. Along the left gastric artery, we have the left gastric nodes. And close to the hepatic artery, we have the hepatic nodes. So, from this area, the lymph will drain into pancreatico-splenic. Then, along this part, into gastroepiploic nodes, right as well as left. Then, pyloric nodes. Then, left gastric nodes. And then, right gastric nodes. Now, these pyloric nodes and these gastric nodes all will ultimately drain into celiac nodes, because this is the location of celiac trunk, and ultimately all the lymph will drain into celiac nodes, and from celiac nodes via the thoracic duct this whole lymph will be draining into the at the junction of left internal jugular and left subclavian vein. See this junction of left internal jugular vein and the left subclavian vein is in this area, and this is the area for the presence of supraclavicular node. So the supraclavicular nodes have some communication with the thoracic duct. So whenever any malignant cell which is traveling through the thoracic duct, they may lodge in the supraclavicular nodes and may produce lymphadenopathy. So many abdominal viscera can lead to metastasis through the thoracic duct into the supraclavicular nodes, and these nodes are known as Virchow's nodes. Some points about the venous drainage of the stomach. So as you know that the veins mainly follow the arteries. So suppose if this is left gastric artery, so the vein from this area is the left gastric vein, and the left gastric vein will drain into the, see this vein, it is draining into portal vein. Okay, this vein, can you see the continuity? So this is the left vein gastric which is draining into portal vein, and the portal vein is formed behind the neck of pancreas. This is the head of pancreas, this part is neck of pancreas, and this part is the body, and close to the spleen is the tail of pancreas. Okay, so the splenic vein, the portal vein is formed behind the neck of pancreas via the joining of the splenic vein and the superior mesenteric vein. Both the veins join behind the neck of pancreas and form the portal vein. So the veins which the arteries which I mentioned you earlier, the veins follow the same arteries and have the same name, and all veins ultimately drain into this portal vein. The one we can see is the left gastric vein, and we can also see the formation of the portal vein via the splenic and the superior mesenteric vein. For example, the right gastroepiploic vein drains via the superior mesenteric vein into portal vein. The left gastroepiploic, short gastric veins drain into splenic vein. So, from the greater curvature, the venous drainage is via the splenic vein, and from the lower part of the greater curvature or the right part of the greater curvature, the venous blood comes through the superior mesenteric vein, and they are draining. And along the lesser curvature, the blood is drained by the left gastric vein. Okay, so this is the portal vein. These structures are present in the hepatoduodenal part of the lesser omentum. Okay, so in this you can see the relation between the structures present in the lesser omentum, free margin of the lesser omentum. So what is this free margin? This is forming the anterior boundary of the epiploic foramen. So as I told you earlier, there are three structures in this fold. The posterior most structure is the portal vein. So my forceps are now holding the portal vein. Then there are two structures which are anterior. This one is the artery. You can see the continuity. So this is the artery and this is the duct. This green colored is the bile duct. Okay, so in the two structures which are present anterior, the duct is dexter, means it is present on the right side, and the artery is on the left. So you have to remember these relations between the portal vein, the hepatic artery, and the bile duct. So this is about the venous drainage of the stomach.